Good evening, everyone. Miss Gibbs, you're muted. But I'm gonna CC you on a bunch of emails as I do outreach to try to get someone in for next month's meeting. So you might see a bunch of emails which you CC'd on it. But I figured with planning, it'll just be helpful maybe if they reply to the both of us. I don't know why I can't hear you. Hi, Miss Francis.
Good afternoon. How are you doing?
I'm exhausted, but I'm hanging in there.
Can you hear me now?
Yes, yes.
Yeah, something with my earpiece. I don't know what's the problem. Let me get my because the kids are talking and I'm not going to be able to hear you. Let me get my sound together.
Good evening.
Hello, Mr. Mensa.
I waited for my friend to come on board for a presentation. All right.
Hi guys, can y'all hear me now? Okay. I don't know what's something with this computer, and I can't. The plug doesn't work. I don't know what's wrong with it, but I had to kick the kids and send them upstairs. Good evening, Mr. Minson. Good everybody. Welcome everybody else. To hello. Welcome everyone to the March 2022 Health Committee meeting. I see we have everybody in the room. Come on in. Come on in. I'm Tamika Gibbs, the chair of the Health Committee. Ms. Watson, are you still here? I can't see you. I see you. There you go. Ms. What?
Hi, I'm here. I'm Kim
Okay.
Watson. I'm the vice chair of this committee. Nice to meet everyone and see everyone that attended. Thank you so much for being here.
Love to see a packed room. We're gonna wait a few more minutes. We're gonna talk about Mr. Mensa. What time is your presenter for this month coming?
I'll find out right now because I don't see him on board.
Okay.
I'm on call right now. I'll let you
We
know.
can you ask them? Can they start at 6:30? We just want to get some our business together before the presenter comes on.
That should be
Okay.
fine. Okay. No
Thank you
problem.
so much.
Mm-hmm.
Good evening, everyone. I see a lot of new names here. Welcome. I'm just writing down attendance as we're going on. Kim, you was asking about the email. I got an email from Ms. Giles of Kings County Hospital while we're just waiting. She just sent me she has a CAB meeting for the hospital. It's a lot. Just send me the emails, Kim.
Yeah, I've been CCing you. The only ones I couldn't CC you on are when I have to go through the website to fill out the form, the request forms, because I don't really know how to add another email to that. But if I can
Okay.
email directly from my account, I'm gonna just CC you on everything. And
Not a
just to
problem.
confirm, my April meeting is gonna be April 21st.
The
That's a
third,
Thursday.
yes.
Okay.
It's the third Thursday. Are we still discussing domestic violence for April?
Yeah, I reached out
Committee?
to a bunch of domestic violence agencies. They said that a lot of places I've spoke to, not only do they talk about domestic violence, but they also talk about how it affects various communities, like the LGBT community, or even human trafficking, how that's all a part of the domestic violence experience. So they have a lot of information to share. It's just trying to find someone who's able to attend our event and also for free. So just trying to narrow that down. But I think I found two Unitas and also the North Brooklyn Coalition.
Mm-hmm.
That's willing to help. But I just need to get them to confirm to attend our April date.
Does anybody in the room have any connects with any domestic violence? For those who just arrived, we've set up a calendar for April. We're looking at I think April is domestic violence awareness. I want to bring a presenter for domestic violence. If you have any resources, or you can reach out to your resource and invite them to our April meeting, which is the 21st, you said, Kim?
Yes, at 6:15 p.m.
Yes. We're a community that's trying to cultivate and liven up the people with all topics that the community wants to hear.
Hi guys. Actually, I met with someone at the office yesterday. It's domestic. Oh yeah. I don't have it with me. I'm sorry. I'm at home today. And one of the service they actually provide is not only do they help them, they also provide them with apartments. I've never heard of this particular organization. I wish I had it with me, but I'll definitely forward you that information. Tamika, I think they will be really great because I think one of the things that when we engage with organizations that say to provide help for domestic violence people, one of the big issues that the housing. And basically, what she said is that they go through an intake process and they actually help them with the housing. Like they pay up to about, I guess, up 2 years, but it all depends on, they work with their income and all of that stuff. But they're fully funded through HUD, which is really great. But they don't work with individual with a voucher, with vouchers.
Okay.
So I'll definitely connect. I'll send you the information so that way you can do a little bit more screening to make sure that this is something for our
Committee.
side over here. Because the woman I'm in Canarsie now, so was talking specifically in or that area over there. So I'll definitely send you that information tomorrow. But it'll be a good resource.
Thank you so much, Ms. Robinson. I'll CC you on that too, Ms. Watson.
Please, Ms. Robinson. I think that's very important. And then I also was talking to some of the agencies about reporting because a lot of families are afraid to report because they think that they're going to get their children removed from the home. So they kind of, in addition to being afraid of their abuser, they're also suffering in silence because they don't want their children to be taken. So I don't know if there's maybe, so I did ask the presenters if they can talk a little bit about that as well. Like, how can we get people to speak up without worrying about consequences attached to that?
Okay. I will reach out to the other arm of my agency, which is HRA, and see if I can get a presenter from Domestic Violence Program to come and give some information on that, or what services the city has to offer in reference to the domestic violence the domestic violence program.
I've also reached out to the Brooklyn DA's office, haven't heard back, and also Safe Horizons, and I haven't heard back yet either.
This computer is garbage. Okay, so right now we're still looking at April for domestic violence. May, are we still looking at Alzheimer's? I'd like to hear some other people in the room. I'm used to seeing this. We have a lot of different people in here. I'm happy, but I would love to hear their voices or what they would like to see or hear or presenters they would like to hear from this year. I see we have a lot of people on the phone, I think. Okay. Urban agriculture. Mr. Mensah wants to hear about urban agriculture. Mr. Mensah, we can bring that up. Also, for those who are in the room, also, we're working on a Welcome to Summer Health Community Board 8 Health Committee event. But we were trying to bring in other committees from Community Board 8, but it's going to be an outdoor event. I have reached out to, I can't remember her name, the Parks Department lady. She said she's going to contact St. John's to figure out what their program, what their scheduling is for the month of June. my question to the committee is just not, you don't have to answer the question right now, but just think of what day of the week we would, our meetings are on Thursdays, but what day of the week we would like to have, if we were given the permit for St. John's, what day we'd like to have it on. I see Miss Granville just popped in. I have a quick question for her. Miss Granville, in the past, when did y'all have the event at St. John's Rec? What day of the week?
If my memory serves me correctly, it was on a Saturday.
Thank you very much. Miss Watson, is that your hand?
Yes. I did see a notice. I think it was from our community board or somewhere that St. John's Rec Center was going to go under construction. So I don't know I don't know which parts of it. Yeah, and it's going to be a 1-year project. So I don't know which parts of it might be open or closed. If the Parks Department could help clarify that.
Yeah. Okay. Let me. I get so many emails from the community board. I was like, okay, this pertains to me. This pertains to me. Check. Thank you.
Tamika, did you have something about sickle cell before?
No, I did not. We're having a presenter coming on at 6:30 to present to us. I have a message from Brianna Edgar. Good evening. Many of the new people are students that attend the same college that want to stay informed about what the most pressing issues that are in our community. This is our first meeting, so we're here to learn. Thank you, students. I don't know what school y'all are from, but thank you, welcome. But your comments and concerns are always welcome, and any ideas you may have. Yes, we need this. We need this, Morgan. The Sophie Davis.
Miss Joseph raised her hand. There was a hand raised.
Thank you, Miss Joseph. I can't see, but Miss Joseph.
Hi. I literally just walked into the door, so I apologize if I look a little disheveled. How is everyone?
Good.
Everyone is doing well.
All right, thank you for having us. I am Constessa Joseph from the Department of Health and Mental Hygiene. And as soon as I hopped in, I heard you mention the health fair. So just putting it out there, we would love to collaborate with you on that and participate in tabling or provide, any support to you for that health fair, right? I believe it's a health fair you mentioned.
Where are you from, Miss Joseph?
The Bureau of Brooklyn Neighborhood Health. It's a division of Department of Health and Mental Hygiene. And we're located at 48 Troop Avenue. I also have my colleague Aska Shabazz on here as well. She will, you will see her more often than me. So just letting you know about the two names, when you see the names, it's us.
Are you okay with putting your information in the chat?
Yes, we will put down our numbers, our contact information, and then we could hopefully collaborate with you if the date is a date, because we have another health fair coming up. So hopefully it's not a date that collides with what we already have going on. But we could provide support and all of that.
I have a
Miss Joseph.
Thank you.
I have an idea from Ms. Tate Hall. She would like to hear about men's health and dementia and the differences, I'm assuming, between the two. And Natalie, you can check the CD8 Brooklyn website for all the listing of all the meetings. We have a chat. Natalie has a question. She's a nursing student, and we have a lot of students here. I'm happy. She was assigned to attend group community meetings, and she's wondering where she get information from. All the information is on the website, cd8brooklyn.org. All the meetings are up there, all listed, all the links are all on there.
Good evening, Ms. Gibbs.
Good evening, Ms. Tahal.
The differences with dementia, there's so far I found out there's 2 different types of dementia. So that would be something that should be spoken about.
Only as it pertains to men, or
No, men's health is one subject. but
okay,
dementia-
thank you. Okay, Mr. Mensah, is your presenter here?
Yes, he is. Yes, he is.
Okay.
So let me
I'm gonna-
just say one thing before we begin. I have the presentation here on my computer. I'm going to share it with you, and he will speak to it as I will be the slide turner, if you will.
Gotcha.
So he can introduce himself, Kwame Ankra. You can introduce yourself, Kwame, and I'll get things set up, and I'll share my screen. When we're ready to start, you start, okay? Kwame? Yeah, Kwame? Are you on mute? Maybe?
Hello, can you hear me?
Yes,
We
we
hear
do
you
now.
now.
Yes, we do now.
Yeah. Good. Yes, my name is Kwame Ankra. I'm a friend of Kwasi's, and thank you for inviting me, Kwasi, and thank you for the community board. I am a sickle cell trait carrier, and I just want to speak briefly about this. Anybody that'll listen? We
Yes,
have
we're
some
here.
slides here. We have some slides here that I think Kwasi's going through them right now. Okay. Are we going to start from here, Kwasi?
Yes.
This is the first one?
Yes. Mhm.
Okay, right. Sickle cell disease in the Black community, more preventable than we realize. We see here the regular blood cell, the round blood cell, and we see the sickle cell on the right. This is what someone with sickle cell would have, except they'd have all of these in their blood. It'd be very painful to get through the veins. Very, very painful. I'm a sickle cell trait carrier, so I'd have both of these. I'd have both round and sickled. It doesn't affect me though. I don't have pain. I don't have crises and things like that. The only time it would be bad is if I had a child with someone who also had a trait. So can you go to the next slide? Can we move? Right. What is sickle cell disease? What it talks about what it actually is, SCD. It's a group of inherited blood disorders. Generally, yeah, I think I covered that already.
Okay, well, let's see one.
Bigger?
Go next.
Yeah.
Okay, good.
Yeah, a little bigger now. Yeah, next one. Approximately 1 in 13 African Americans carry the SC trait, such that would be me, and many don't know they have it. This is my main thing. When I ask a lot of people if they have it, they don't know, and a lot of us are not getting tested. So I didn't know until I was 22 years old that I carried the trait. I didn't know actually until my daughter was born, and she has the trait. I didn't know that her mother did or did not have it. So she could have been born with the disease because I didn't know. So that's a bit of a problem. So each year, Black children are born with this because the parents don't know, they're not tested. An estimated 100,000 people in the United States have sickle cell disease. Annually, approximately 2,000 babies are born with sickle cell disease. 2,000, yeah. It's not so limited to Black people. Latinos make up the second largest number of SCD cases. And over the yearly population is 300,000 people a year are born with sickle cell disease. That would be over a period of time. So 300,000 a year times, however many years, maybe 10, 20, 30, 40, 50 years. That's several million across the world. Can we go to the next slide? Oh, right. These are this is what it feels like. I don't know anyone with sickle cell disease. So I carry the trait. So I'm reading about this, but I actually don't know anyone who has it. Blockages in blood flow can lead to the following. Mostly it's pain. Mostly when you talk about people who have it, it's severe pain. Vision problems, anemia, lung tissue damage, frequent infections, swelling in extremities, fatigue, stroke, delayed growth. Yeah, people with sickle cell disease often don't grow at the same rate. as regular children do. So they're often underweight and undersized. Shortened life expectancy, yeah, people die a little early. We had a rapper named Prodigy from a band called Mobb Deep. I don't know if anybody knows him. He died at about 41, 42. So that was unfortunate. Very unfortunate, died so young. STD is a worldwide health problem which can be addressed. I can't really,
Next slide.
how do I get back to the screen? There we go. Next slide, please. Yeah.
Okay.
Sickle cell disease affects millions of people worldwide. This is not the best map, but it shows exactly where the concentrations are. You'll see sub-Saharan Africa, shows the entire of South and Central America, and parts of India, Bangladesh, and some Mediterranean states. In that part of the world, it's called thalassemia. It's not called sickle cell disease for whatever reason. I'm not certain, but it basically amounts to the same thing. Indians do get this. But but in terms of Black Americans and African people, we're talking about sickle cell disease. Next slide, please. SED in Nigeria. Yeah, Nigeria is one of the major countries affected by this. A very heavy concentration of people in Nigeria. They account for most of the cases of. Here's some strange noise. Yeah, Nigeria has a.
We're here right now.
Disease. Yeah, can you hear me?
Yes, yes, now.
Okay. An estimated 150,000 annual births of babies with sickle cell anemia, the most common form of sickle cell disease. Nigeria is actually very proactive in this. What I've heard about Nigeria is it's very common for people to link up, men and women to link up and ask each other their genotype, with meaning if they have sickle cell trait or not. That's part of the dating process. And even when you get married in Nigeria, it's that you have to submit your blood test because they don't want this to spread. So I found it to be the most proactive country in the world as far as this is concerned, more proactive than we are here in the United States. So I'd like us to at least kind of get on the ball with that, like Nigeria is. At least 100,000 babies die of the disorder in Nigeria, according to 2014 statistics by the World Health Organization. Yeah, I mean, they don't have the same health facilities we have here. Someone born in Nigeria may not have access to things we have here. So, again, prevention is the main thing we want to look at. Next slide, please. Oh, here we go. Here are the demographics. So we see at the top is Nigeria with 91,011 births per year. Next is Democratic Republic of Congo, 39,000. So that's less than half. And it goes down all the way down the line. Ghana, which I went to, is 5,000 a year. Lowest being Niger, which is 5,000 births a year. Ghana is an interesting place because I had when I went to Ghana, I actually had a sickle cell test done there in Ghana in a clinic. Very cheap, maybe like $2 I paid for it. But they don't do much outreach in terms of their letting the public know what's out there. You don't see a lot of public service announcements, yet many people are affected by it. So but it's very easy to get a test. Ghana has a health service, a free health service similar to what they have here in the United States. So very easy. It took maybe 20 minutes to get the test. So next slide, please. What can we do about combating sickle cell disease? Yeah, we can do a few things. There's several things we can do. Get screened before you decide to. Yes, that's the first thing. You want to get screened. Hopefully, definitely when you have children or you get married. But even if you're not, you need to get tested. You want to know what your status is because you can pass along this information. You can donate blood. If you have regular blood, which is called AA genotype, you can donate blood. Okay, it goes back again into the genetics of a child. Child gets sickle cell when they have two parents who have sickle cell trait.
I'm sorry.
We already went back, didn't we? Went back there. Oh, okay, this shows the breakdown of how this can happen. So the main one we want to be concerned with is the box in the lower left corner. And that would be 2 people having sickle cell trait, which is either blue and the red. So blue being normal blood, the red being sickle blood. They have so the breakdown is in one birth, the child that they potentially have would have a 50% chance of having a trait, not so bad. 25% chance of having nothing at all, being no problems at all, AA blood type, or 25% chance of having full sickle cell disease. Those are not good odds. 1 in 4 basically of having full disease, which is the case how most people get it. So that's not good. This is still avoidable. And we have some writing here. Right, 25% chance, yes. And that's per birth. So that means conceivably, if you had each child, so if you have one child, that gets 25% chance, the next child will also, it'd be the same, do the same possibilities there. So you'd be kind of limiting your family to one child if you do this. Next slide, please. Oh, here's the last slide. Yes, you can donate blood. Sickle cell anemia people need blood transfusion. They on a regular basis have to get new healthy blood pumped into their body. And according to this, I can't read this very well, but Black Americans or Black people generally are the lowest demographic of people who donate blood. And sickle cell patients need blood from their own ethno-demographic group. So you can donate blood, or you can give donations to a group such as the one here. This group is the Sickle Cell Disease Association of America. They have a lot more stats than I would, but yeah, they even have an office here in New York City, I believe. But donating blood or donating money. If you have sickle cell trait like I do, you can't donate blood. I can't donate blood. I think that's our last slide here.
One more.
Oh, celebrities. Oh, excellent, excellent. I like this. Yeah, these are some of the celebrities we know that have full sickle cell disease. Lawrence Tate, you might know him from the movie Why Do Fools Fall in Love? I think he played Frankie Lyman. I think he was, and he played a couple other movies he played in. T-Boz, who was from the group, the Grow Group, TLC. Yeah, okay. She has full blown, yeah. New York Giants, Tiki Barber. I think he's a running back for New York Giants. Yeah, he's done some PSAs for sickle cell. Done a few. Mobb Deep, yeah, unfortunately Mobb Deep, which is his name is Prodigy. He's unfortunately passed away. May he rest in peace. Paul Williams. Oh right, Paul Williams was, I don't know, was he the lead singer of the Temptations?
I think so.
Or was that
Kendricks?
Eddie Ruffin? I'm thinking. Oh, okay.
David Ruffin.
Ruffin. Yeah, David Ruffin. Okay. Well, Paul Williams, I don't know who he was. I gotta get a picture of him. Miles Davis, we know. Yeah, Miles Davis had full blown sickle. Yeah. And lastly, Pittsburgh Steelers, Antonio Holmes. I don't know him. Wow, now he's playing football and he has it. It's amazing. There's probably others out there that I don't know of. Maybe some Jamaican singers, maybe some African singers, but I only know these few. Yeah, so and that was kind of a quick run through of this. Is there any questions I could answer?
First, hi. I don't want to mispronounce your last name. Pronounce that for me again.
Ankra.
Ankra. Thank you, Mr. Ankra, for your presentation, and thank you, Mr. Mensah, for controlling the slides. I just have, it's not a question per se, it's more of a observation. I know in New York State, I'm not sure, as far as men go, I'm not sure how often or what would probably be the mode men would run into testing in the hospitals. But I know with women, usually when they're preparing for childbirth, preparing to get pregnant, or if they're already pregnant, they actually do testing for genetic abnormalities. and do a genetic testing and a genetic mapping in case you or your spouse, you or your person you're having a child with, have one of the disease such as sickle cell, so they can avoid or prepare the parents, especially if the parents are already with child, prepare what's to come, or to make a determination, do they want to move forward, especially if the other parent is sickle cell, has sickle cell. So I can attest to the state of New York. As far as other states, I'm not too sure. Or even if at what point, can I ask a question? Were you in a medical facility when you found out you had the trait? You said you found out when you was in your 20s, correct?
Yeah, I didn't. I found out when my daughter was born. After she was born, she got tested. And her mother said, well, you have sickle cell trait because your daughter has it. Her mother didn't have it, so therefore, by deduction, I had it. So it's only by luck. It was only by luck that,
Usually acts. I don't know how long ago that I don't know how long ago that was, but I know now, within the past, I can attest to the last 15 years. They ask if the mother comes in by herself, they'll ask her, they'll do a genetic testing and ask about the genetics of the other person who is
right.
they're not only theirs, but they're actually a family background if certain things run in their family. But like I said, you said, you didn't find out until you had her, but most of the time men probably wouldn't have that opportunity to just do random testing, because it really doesn't, like, they're not in a setting, unfortunately, to undergo these kind of tests for any random reason. Okay. Maybe New York need to do a better screening of all genetic testing for the future. Maybe in annual checkups. Just thinking.
No, that was actually gonna be my question. Just to share a little bit, I am going through the IVF process right now. So one of the first steps is that my partner and I we had to take what's called a SEMA4 blood test. So what I learned was that everyone carries a trait for something, because there's over like 3,000 something genetic mutations. But like you said in your presentation, just because you carry the trait doesn't mean you actually have the disease. But sickle cell is some of the major genetic disabilities or mutations with some of the, or diseases with some of the ones they looked for. And I thought to myself, how come they don't do this for every like family, every person that wants to have a child or start their family? But then I started thinking about it, like a lot of people probably are not in a place where they're planning their pregnancy. And I'm just thinking to myself, like, when it comes to family planning, like, we really need to beef it up and really promote that so people can get this test done in advance.
Yes.
Yeah.
Mm-hmm.
But I had in my testing, I came out with something for anemia, and another thing where like another trait where the body can't break down fat, and then my partner had like two different ones. So thankfully we weren't a match in any regard, but it was helpful to know that. And then they said with the IVF, they're able to actually, after they make the embryo, see which embryos, let's say that both parents carry the trait, they can see which embryos have the sickle cell or not, and then the family can decide how they want to move forward. So I do think we're making some advancements here, but I do believe that, I was lucky enough to be able to plan my family, but what about people who aren't in that position? How can we make it more of a routine?
I see you, Miss Granville. I see your question. There's a wait a minute. There's somebody, Miss Tate Hall has a question in the chat. Wasn't the blood test obtained before a marriage license? Actually, in the state of New York, a blood test is not required for a marriage license. So that answers your question, Miss Tate Hall.
And I was going to say the same thing, because I don't remember in '92 taking a blood test before my husband and I got married. And with all these things that's going on, it should be required that you take a blood test so you know.
I remember when I got married that we had to take blood tests. So now you're telling me
that?
That's a long time.
I've married 20 years and I didn't have to take a blood test. And you would think I thought that I thought when I did the license, I was like, why do I take a blood test? Because I lived through the AIDS epidemic, and those kind of things had already, the AIDS and the crack and the all other kind of stuff that came along with that. I found that awfully odd. Luckily, me and my husband was together long enough, way longer before then, that we had known each other's medical information. But maybe if New York probably instituted that, along with maybe doing gradual random testing for, not random, but a yearly test, so it won't. I understand it's all about dollars and cents, and these tests are very expensive. But maybe if they did a series of tests over the years, when kids did immunizations like every 5 years, do a test for this, do a screening for sickle cell, do a screening for leukemia. These kind of things can be done spread over an amount of time, so it won't be costly on the medical insurance company. Maybe so when a child does get to an age to reproduce, they at least know I have this. I have a trait for this. Thank you, Ms. Watson.
Tamika?
Yes,
I
ma'am.
just wanted to say that if they did a study, they would probably find that it's less expensive to have people tested before than to have to pay out thousands of dollars for something like this. And it's my understanding that a lot of people who have sickle cell disease are not being treated very well by the medical community, because when they tell them they have pain, they act like because you're darker than salt, you couldn't have pain.
Wow.
You know, I don't know what year they stopped doing the blood tests before obtaining a marriage license, but here in New York City, it was mandatory at the time when I married.
1899.
1899 or 1999?
I was kidding.
Oh.
I wouldn't even answer
I'm
him.
kidding like that, Quasi.
But I wouldn't even pay him no mind.
That's
Seriously, it's something they need to think about. Seriously.
Yeah.
Yes, it's true.
I say that because I didn't know if you were going to share that, Ms. Watson, but I remember going through all of the genetic testing and all of these tests. Me being someone who didn't like needles, to being pregnant and considered high risk because of my age. You're a stick pin, and they literally test you for everything under the sun. So I would just imagine that bill from just that short amount of time. And it had to be like a 22-week period. It's 22 weeks they start, and that all of those tests for the blood at one time before the child even gets here.
Yeah.
So you can imagine that amount of medical bills if they had done it incrementally the entire time, or at least have some kind of record. The parent of the child as they were growing up, just like we keep immunization for our kids and for ourselves, keep our immunization like, okay, we ran a test, we ran a panel for this, we ran a panel for that. Add the panels to the annual immunizations. It's all a win-win situation. Maybe you could talk to somebody in Congress about that, but who knows?
Yeah.
Ms. Granville, your hands up?
Listen, I just wanted to say it would have to be women that bring it forward. Because a lot of these folks, those old folks in Congress, and they don't look like us, they're not going to think about it.
Well, we have a room full of students here that are here to maybe get that ball rolling.
Yes. Definitely are the future of healthcare. Are there any other students with questions or comments?
Our young people are not usually this quiet.
You're more than welcome to use the chat as well. The chat is available, and you can type in it if you want.
We do have a question from Alex. Hi, I hope everyone has been well. If I may ask, what is the role of the Health Committee for Brooklyn CB8? What are some of the most pressing health concerns that are impacting our community?
Thank you for asking that question, Alex. The Health Committee main purpose is to hear from the community and bring out resources and whether their concerns as a pressing to them. Each of us on the committee and in the committee and on the entire community board all live in different sectors within the CB8 guideline, within the CB8 compounds, and we all have different health concerns. In September, we had each month. If you heard from the beginning of this meeting, we set out an agenda of things that we'd like to hear about, information we'd like to bring back to the committee, to the other fellow members of the health committee, and to bring that to our neighbors, friends, and the other people that live within Community Board 8, as well outside of Community 8. So that's our purpose, and things that are impacting CB8. I'm not sure if you know where CB8 is, but it's mostly of African descent population. Things that affect us, unfortunately, the most typical: high blood pressure, diabetes, but we also tackle things, mental health. That's a big topic in our community, for New York in general, but especially in the Black community. Anything else, Kim? I see you shaking your head.
Yeah,
Kim?
I also like to add that we kind of also have the flexibility to provide information to our community on things that are currently trending. So we had a doctor come in to discuss COVID, the vaccines, the disease process, what we know so far about the different variants. So we were able to respond to our community with that information. Then also when they had the fires in the Bronx, we had the FDNY come out and talk about fire safety. So there are the general staples, like Ms. Gibbs just mentioned, but then like as things pop up, because maybe it's like I hate to use the word trending, but maybe because it's just a current event, then we respond in that way as well. I hope that answers your questions, Alex. But if not, feel free to keep clarifying with us.
Mika,
Yeah.
some
Yes, my
years
mute.
ago, we actually had a diabetes task force in Brooklyn. Don't ask me why they let it drop, because the whole of central Brooklyn is considered to be a very high prevalent area for diabetes. And now that we have a mayor who was a diabetic before he drastically changed his diet, maybe at some point before he leaves office, somebody will put some focus on diabetes again. Because I actually heard them say that people who are overweight, they were concerned because they were saying that the vaccine might not be as effective for them. And my mother was a nurse, so I couldn't quite understand, how do you give everybody the same dosage? Because I thought certain medications were supposed to be tied to your weight. So if the person is larger than average, how is the regular dose going to be effective for them? I couldn't quite understand that.
In reference to Ms. Granville, are you putting up your hand after you speak, or is it just my computer?
That was a slip on my part. I did not mean to do that.
Okay. In reference to the mayor, I'm not sure how many of us have children that are in school other than myself, but he is making changes. I know with the public school system, he has changed Fridays to vegan Fridays because of the health problems that he's trying to avoid for the young kids to avoid when they get older. Maybe we have a new administration, and we have a lot of things they're trying to get healthy, because most of the people in the past 2 years have become very sedative, and if you have issues prior to, you probably exacerbated them through the past years, and then you probably got some more problems over the past 2 years for whatever reason. But I think New York is probably moving in the best direction. We can probably speak to. I'm sorry. We're gonna probably can speak to Ms. Joseph from DOHMH about maybe what are their projected plans they may be having in the coming down the pipeline, programs to help the community, and maybe they are bringing back that diabetes bureau, because I didn't know the Department of Health was named back to the Bureau of Brooklyn Neighborhood. They're changing names everywhere. I see a hand, Miss Marshall.
Hi there. My name is Sharon Marshall. Contessa had to leave to join another meeting. I'm using my phone right now. I presented maybe a couple of years ago to Community Board 8 regarding maternal mortality and shared the maternal mortality report. So yes, there's always some changes in branding as far as the name. So it's the Bureau of Brooklyn Neighborhood Health, and we cover three sites. We have three physical sites, one at 485 Troop, then at 259 Bristol Street in Brownsville, and then in Bushwick on Central Avenue. But that doesn't limit us. We do focus on the health and well-being of those living in Central Brooklyn. One of the things that you may be familiar with is that we've had an ongoing vaccine site at Brooklyn Children's Museum. But as far as some of the work as we are moving from the, and I want to also mention that Ms. Aksa Shabazz, who's one of our community health workers, is on the call as well. As we're moving into this kind of recovery-ish phase of COVID, you know, the lessons learned, we know who fared worse. We know in Black and Brown communities, they fared worse outcomes. And even going back to how I did a maternal mortality discussion a few years ago, that even during the pandemic, maternal mortality rates increased for Black and Brown women during that first year. But some of the drivers just for premature death are definitely diabetes and hypertension, obesity, and all that. And so we are reaching out to the community boards within our purview within Central Brooklyn to work with you to see how we may help bring resources. Okay, bring resources to you as well as best we can. I know my connection, I think, is spotty right now. I think. Yeah, so that is really essentially it. One of the things that we have been doing is looking zip code to zip code, and even smaller than that is looking at vaccination rates and positivity rates. So we're still, as much as we're reopening, we're still doing surveillance and seeing how we may support stakeholders within each neighborhood to increase vaccination rates, or at least have access to testing and things like that, as we're trying to move into, I wouldn't even want to call it a new normal, but you know, because I want us to be better than we were before.
Thank you so much, Ms. Marshall. We have a question, or maybe a question in the room from Marie Elena Harrison. Hello, everyone. Thank you for this amazing meeting. As a student from the Bronx, I have learned plenty. Is there any reform you would like to be enacted within your community that you would think will provide a positive change?
I think about when we talked about the family planning, and that can start even early into the pediatric years, assessing for any type of traits or genetic abnormalities that might affect, you know, that youth when they do become of age or are ready to start a family, or even in the case of an accidental pregnancy, or unplanned pregnancy, I should say, they are aware of what is going on inside of their bodies, which is something that we'd have to most likely advocate for to have happen. And then I was also thinking about one of the current major topics right now, which is addressing mental health among the homeless population. Especially in Crown Heights where I live, I'm only a block down away from a men's homeless shelter. And since the onset of the COVID pandemic and the stay-at-home orders, when we stayed at home, I noticed that they came out a whole lot more. And there's nothing wrong with that, but we just want to make sure that everyone in our community has a level of wellness to be able to interact with one another safely. But I did read somewhere today that the mayor went to Albany to seek out involuntary placements as a part of reform to see if people who are really not well enough um, are unable to make decisions to remain in the community, but they get involuntarily placed in a treatment facility until they're well enough to be reintegrated back into the community. So I know there's some talks and plans around that, but I do think that that's something that has to happen in terms of improving communities.
Thank you for that, Ms. Watson. Anybody else want to touch on Ms. Harrison's questions before I move on to the next question from the chat? Okay, I don't think I see any. I have a comment from Miss Ben James. She states, my old ophthalmologist told me in the Jewish community, they test all babies when they were born for everything that affect that community and filed it away. When that person got of age of getting married, they go to the file to make sure two people with same issues stay from each other. He said he doesn't know why it hasn't happened in Black community. I can answer that question.
Yeah, but hi, I just want to also kind of frame these questions. These are the discussion, and it's what we call preconception health. And so as we look at the life cycle, we know that certain things help to if a person decides to become a parent, that certain things should be in place or are understood. So when I discuss maternal mortality, rate, to also have to understand that Black and brown people are more likely to be diagnosed with chronic disease in the height of their reproductive years. Okay, so also part of preconception health is also the genetic testing and understanding. So it's a series of different things that help to give you the optimal chance for a positive outcome for the baby and for the birthing person, as well. So there is limited genetic testing that does happen to all people, but I do agree that it needs to be revisited, and also trying to make primary care accessible, and that there actually be like conversations between you and your provider about how certain things connect to your ability to have a successful birth outcomes as well. So testing is a part of what we would call preconception health. And that's some of the work that we try to advocate for within the health department.
Thank you, Ms. Marshall. Anybody else want to tackle Ms. Ben James' question?
Repeat it again.
My ophthalmologist told me in the Jewish community they test all babies that were born for everything in that community and filed it away. When that person gets of age to get married, they go to that file to make sure the two people with the same issue stay away from each other. He said he doesn't know why it doesn't happen in the Black community. Anybody want to touch?
Because we didn't know about it. For so long, we were considered property, so we probably didn't know that was being done someplace else.
I think also is because in Jewish community, the people before they are getting married, they don't really know each other. But in Black community, people are choosing each other and doesn't really make the first connection because of the DNA and because of the genetic diseases.
Thank you, Natalie. Thank you. That totally slipped my mind. They still have arranged marriages, correct? Yeah. Good. Natalie, you're from the school? Are you one of the students?
Yes.
Thank you. Thank you.
Thank you, Natalia. That
I
was good
also,
perspective.
yes,
The fact
it gave
that,
us, yes. There's another question in the, oh, it's a comment. Oh, no, it's two from Miriam Kwarashi. Thank you so much for all the work that you do. I realize that there are a lot of things, a lot of work that still needs to be done, but have there been any reforms made recently that you feel have been beneficial within the community? Anyone?
well, I know for me personally, and I think this was I have to look at the year, but I know in New York State and very few states in the US, New York being one of them, where your insurance can cover IVF. Most families pay upward cost of 20,000 or more just to be able to start their families, and I'm grateful that New York State is through my health insurance is covering my full IVF cycles. So that's something I appreciate because I know before a few years ago that wasn't something that existed for a lot of women or families who were planning to have a child who probably had struggles in conceiving naturally or could not conceive naturally, but depending on their sexual orientation. So I'm really grateful that this exists now. And again, it's only very few states in the US where health insurance has the option to provide coverage for that. So I know that's something that's been beneficial for me. And especially being a person of color, especially being someone who couldn't afford that out of pocket costs, so that's been helpful. And I also think that when it comes to heart disease, diabetes, obesity, I mean, although we still have a lot of work to do, I think we've, in terms of just being informed and being able to make better decisions about our lifestyles, our food choices, I think we've come a long way in that regard. Definitely come a long way. And I've been reading a lot of research, and I know it's still in the early stages, but a lot of scientists do believe that in the near future, in the very near future, they will be able to actually stamp out the genetic trait for sickle cell completely. So people will not have to worry about, and, as people continue to procreate more into the future, that's not going to be a thing that people will have to think about or worry about or test for in the years to come. So those are some things I think will be beneficial, not only in our specific community, but just in our community of people of color, where these things, sickle cell, diabetes, heart disease, obesity, affects us the most. And there's also a misconception that infertility does not affect people of color, and that's not true.
Nope, not at all. Miss Marshall, you have your hands up, or is that no? Oh, okay. I'm just making sure. Another thing, another another new reform I feel that has been beneficial to our community, specifically CB8 and Central Brooklyn, was the use of the SNAP cards at the open fresh markets. I'm not sure where this, I think it's a student, but I'm not sure where the student is located. But at one time, you had to physically go into the grocery store to get fresh fruits and vegetables. If you look at CB8 district 10 years ago, there weren't that many supermarkets. If there were any fresh fruit markets, now we have several farmers markets, different locations within CB8 confines, or even on the brim of CB8, where you can take, if a person has a SNAP card, they can take those SNAP benefits and buy fresh fruits and vegetables for their family. I think that was a huge reform. I don't know exactly when that started, but has been within the past, I want to say 5 or 6 years, but no more than 10 years. That has been a huge reform and has been opened up a lot of options for families in CB8 and around CB8.
And if I could piggyback off of that, and just with the EBT, I know since the pandemic started, New York State has started, or maybe specifically New York City, has started to issue EBT cards directly to youths, school-age children. They have their own EBT cards. They were all supposed to get them by mail. If not, there is a 1-800 number that families can contact. I called for one of my students because she didn't really know how to use it. She had over $400 in food supply. Because remember, our children were home remote learning,
yeah.
parents didn't have the extra funds. They were depending on the school foods to provide those extra meals. So the fact that the city not only gave them EBT cards but a small budget to supplement the food in the household, that was very helpful.
I was just reading the chat.
We have
The
we have
IBF.
two hands. I'm sorry.
Go ahead.
We had two hands. I don't know who was first. It was either Princess Ben James or Osarume Omorui. I hope I'm saying your name correctly. But
That's fine.
would you like to go first since you're unmuted?
Oh yeah. Good evening, everyone. My name is Sarah May. I know you can't see me because I have a baby and I'm doing so much right now. I'm actually from Monroe College. I just wanted to talk about the sickle cell thing. I was listening to the guy's presentation and he said Nigeria has one of the highest rates of sickle cell. I'm Nigerian and I know before I moved to the US, sickle cell was a serious issue because first I was in a relationship and I found out I was AS and the other person was AS and we had to end it because of how much we knew about sickle cell. Unfortunately, I also have a cousin that has sickle cell, and when I met my husband and when I told him about sickle cell, he was like, "Oh, what's that?" He lives in the US, so it became like a surprising thing for me because I'm like, how come we know so much in Nigeria about sickle cell, and you that live in the US, you do not know much about sickle cell? He doesn't even know what his blood group type is. Like, I don't know. And I realized that educating people about this genetic disorder is one of the best way to curb this issue. So not just genetic testing alone, but also educating a lot of people, like getting testing, knowing what your partner's genotype, blood group is, and all of that would really help the community instead of just go to the doctors and telling them, oh, you have to do genetic testing if your husband is. So many people won't want to listen to that story at that point. But early education about this, going to schools, letting kids know, children and teenagers and adults, colleges and all of that would really, really help the community and curb this issue of sickle cell. So that's just my take on it. Thank you.
That's actually a great point because, like you said, when someone's already locked in to a marriage and began planning their family, it's a little too late. But how do we get ahead of that curve? And you're right, education throughout the younger years is a great way to target that. Miss Ben James?
Hi, good evening. Yes. This is a research I got into because my granddaughter, her mom has my granddaughter has a sickle cell trait. And that's my youngest son's daughter. So I went into research, and this is prior of my doctor saying, and I realized that if my granddaughter end up getting married to somebody with a sickle cell trait, they can have a child with full-blown sickle cell. Yes. So that is something I'm working on, and that's how I found out all what I'm putting in the chat, because the biggest research group for the Jewish is located right here in Brooklyn, where they do all the testing and the research when it comes to. And what I put, the Jews continues doing it. They do a DNA test in school and they walked around with that card. So when they meet their significant other, they make sure they compare the ID number. And it's being done by the Ashkenazi Jews and all the other Jews. So it's actually happening here. And even Jewish young boys and girls who know each other, it's still happening, but it's not happening in our community. And I hear what everybody is saying. I got involved after I found out my granddaughter has a sickle cell trait, and I really didn't know much about it. I only hear sickle cell. But until it hits home, and because it hits my family, that's what made me become proactive. And to find out, yes, the biggest research when it comes to DNA and sickle cell and all the issues that affect our Jewish neighbors, it's right here in Brooklyn. So all the Jewish people from all over the world send their DNA right here in Brooklyn to be tested and filed away. And this is something I found out during my research. So you see what they're doing? They literally, so if you approach a young boy, Jewish boy and girl in high school, they do have that card with them.
Mm.
Do the DNA test. So when they get the age, so it's not happening last year, it's happening presently. So I think that is something we in our community we need to push for.
Thank you,
Because
Ms.
people, yes.
'Cause I
Thank
had
you.
no idea until you put that in the chat. I was
Yes.
completely clueless.
And that the biggest research lab for them is right here in Brooklyn. Ms. Gibbs, I'm gonna forward it to you because I did my research. That's how I know. Yes, it's yes. So we need to do something like that in our community. Somehow we need to bring it up to whoever it needs to be. Yes.
And maybe we could even spend some time with the Jewish community leaders who are a part of the DNA collection to learn more about their process and how they collect and how they get families to be on board, just to learn more about it. I think that's where it starts also.
Yeah, but it's a card they carry around in high school. They get DNA tests in high school and they carry it. So when they get the age to marry, they compare ID to make sure the ID are not the ID numbers. So they know how to read those ID. Funny that they're being taught this young how to read ID numbers. So for them to understand that reading, that tells me that this is something being discussed in the community and being discussed in the family and being discussed in the home. And like I just heard the young woman spoke, she was like, and a lot of us, I certainly if you ask a few of us, and we cannot tell each other our blood type. Because a lot of us adults don't know their blood types in our community. And that is something needs to be changed. Thank you.
Thank you, Ms. Ben James. Thank you so much for teaching us something tonight. But yeah, education's where it all starts. Anyone else wanted to? Oh wait. Anyone else wanted to share? Or had a question? This was such a great conversation we had this evening.
Yes. I think so.
Yes, it has been very insightful, very informative. The students from Monroe College, what class I'm just curious, what class is this for that y'all have to attend community meetings?
It's a community health class.
Oh.
Yeah, the nursing community health class.
Oh.
Yeah.
And I think we also have students here from City College. Is that the same course as well? Thank you, Marie Elena, for posting that. Oh, that's the City College course, the Population Health Community Health Assessment. Okay.
Gibbs, can I ask a question? Is that something new that is being offered in colleges, in nursing school?
I don't think so. I didn't go to nursing school, but we had a community health class, but it was an elective if you wasn't in a certain concentration in school.
No, but for them to come into the community, I know it's being offered, but for them to come into the community, I know those is being offered in college. So by coming to our community, that's why I asked, because I've never heard it done before. So that is fairly new to me. Maybe all the people know about it, but they come into the community.
It varies from institution to institution, but I have witnessed students participate in very community-based organizations, their discussions, and so I have with other community boards, there have been students that have been in attendance, but they also are, sometimes attend coalition meetings and various things as part of the requirements for their class.
Got it. Thank you for that explanation, Ms. Marshall.
Yeah, and that's been going on for a little bit. A little bit. I've been working at the health department for a while, and so we kind of triangulate also with schools, and I do encourage any of the students there, especially those pursuing community health to look into our HRTP program, which gives opportunities to students considering health careers to have internships within the health department, paid or unpaid. Either way, you would still get the credits. In fact, I think the season is kind of opening for those who have already applied for HRTP, but consider that applying to be a part of the program for the fall.
Wow, thanks.
And I like community college and other non-Columbia. I like getting Medgar students and things like that as my my interns to do some of the community work that I do.
We have a question. Go ahead, Ms. Francis.
I think it's not something new because I think now since the COVID, they're putting them even in the senior centers, because I met a lady on Friday. She comes once a week and she said it's a part of her internship that she's at the hospital. Then she spends some of her time going to the different senior centers to talk and help with some of the seniors. So that's a good thing. I thought that was very nice. And she comes once a week to this center.
Thank you so much for the links in the chat, Ms. Watson. Anybody had any questions about the information about the internships with the HRTT program? Let's put it in there. Students, get it on there. And anybody else who's interested. Do we have any other questions?
Tamika?
Yes, ma'am.
When I find it, I'm going to forward you some information about the Black Women's Health Study.
Yes.
It's taking place over the last 25-year period. I think I went into it when I started to subscribe to Essence Magazine. And they usually do research and surveys on topics that are relevant to Black women. And they publish reports periodically, and it's something that the students might find useful.
Okay. I'm glad you said that, because I actually I received an email, a topic from Mr. Thurton, who's the chair of the Public Safety Committee, and he had a question. He wanted me to present to the committee. It's a little off topic, but it's definitely a topic for us, for this committee. He wanted to know, maybe the students can probably even help us with this. Has there been a study of the effects of has there been a study of the effects of the long-term effects for children who were born addicted to parents who were crack cocaine users? I don't remember the conversation we were having about that, but he was really concerned in reference to the children today. I can't think of it right now, but he wanted to know, is there any, I'm sorry, I was reading off the side. He wanted to know, has there been any research done on following the children that were born addicted to parents who were born addicted to crack cocaine back from the 70s and 80s, and have they tracked the children in school? And because he wanted to know, could that have been a reason why there are so many children in school who have been in school or out of school that has so many ADHD and other mental learning disabilities because of their parents' past behavior? I had sent him some information about research for these topics, but he just wanted me to present that to the committee. There's a lot going on in the chat.
I'm sorry.
No problem. I'm glad you handled it. I'm like, I just see my screen going up and down. So that was all I had to say. Ms. Watson, I see that you want to talk about going over there.
No, it was just about the internship. So I did drop a link from the New York City website, but then also because we do have 2 to 3 people here from the health community network, I believe, with Brooklyn Neighborhood Health. They may be a great point of contact to just save their information, email addresses. So as you go through the process, you have someone that you can network with and possibly ask questions about for future internship opportunities. And it does look like Ms. Marshall mentioned, the applications are open now. Ms. Ben James?
Yeah, okay. Funny that I don't know, I'm having problem with my camera. That's why it's off. Okay, I'm doing a research on right presently on trauma and suicide because I have to do a presentation next weekend. New York ranked number 12 in suicide. In this, the other state, but we in New York ranked number 12. We ranked second in the age between 10 and 34 when it comes to suicide. We ranked fourth in death of the ages between 35 and 54. We ranked 9th in the death of 55 to 54 and 18 in the death of 65 and older. So that is something our community needs to tackle, suicide, because I didn't even ever know that we ranked number 12 when it comes to suicide in New York City. And can you think about it? We ranked number 2 between the age of 10 and 34 with suicide. 10-year-olds are talking about suicide. Not even talking, they are committing suicide. And 12.2 million seriously thought about suicide in this country. 3.2 million made plans for suicide. 1.2 million attempt suicide. And suicide had gone up in New York City when it comes between our non-binary, people who are gender reassignment and all. So it went up in our Black communities. And I know that up to today, I had to deal with a young man who his dad chose not to accept his lifestyle. And I have been making calls to find a place for him to go to and not go back into the house. And this is right here. So I think that is something we need to bring to the table. And COVID did not help the situation in our community. Last Saturday, I was on the train, so I had to go to a breakfast. And when I got on the train at Nostrand, I got in from Bedford Avenue, and there were 4 carriages full of homeless people. When I'm saying I count almost 50 homeless people, you can realize that they had the dinner there and they also had their breakfast with all the debris on the floor, all the bags and the food bags. And every one of these young men in that carriage looked like you and I. And this was at 7 o'clock in the morning here in Nostrand, 4 carriages, because I keep going from one car to the next, hoping like, okay, I end up, the 4 carriages from the back was all people homeless. And that's our community. So it needs to be addressed. So I hope we can talk about that, Ms. Gibbs and Ms. Watson, in our health meetings. Thank you.
Thank you, Ms. Ben James. That's definitely something we could look into and maybe even connect with the mayor's office around, because I do know that they are planning to roll out some initiatives to address the homeless population, specifically in the subway system.
Sorry, you cannot address homeless. One of the things I've been telling people when I speak, you cannot address homeless population if you do not address the educational system. Because all of these people on the street, they were once a student. And we have the highest population of special needs. If you start giving children medication at 5, as Sigmund Freud said, at the age of 5, they have the it. They are still growing. You disrupt the neurons at the age of 5. At the age of 13, a child can refuse to take medication. Eventually, he or she has to get something to replace that. They end up on street drugs. So it affects the community, it affects the home. So you cannot address homeless population until you address the school system. Because I'm in school and I'm fighting with my supervisors every day because when it comes, because a lot of our students are running the building whole day, they're not learning. And 21, they're going to end up at the homeless shelter by us. So we need to address education overall. So that's the only way we can avoid homelessness and displacement in our community.
Thank you for that, Ms. Ben James. I've also been reading a lot about the foster care system and how that ties into homelessness in adulthood. Because children are being discharged from foster care without any permanency plans. So then they end up in the streets, especially if these are youths who have mental health disabilities. But children in foster care are some of the most highly traumatized youths in our community. So we can suspect that there is some mental health concerns and emotional wellness concerns at some point in their lifetime or throughout their lifetime. So I definitely do agree with that. Like one point of intervention, definitely education, but I do, based on some stuff that I've read, believe that foster care and like child welfare might be another avenue of intervention as well. But thank you for bringing that up.
Thank you. I see a lot of our students are exiting, but they are. If anybody get over the chat, they have learned lots that they said. They hope that I asked that they will be back. In reference to one of the other avenues, just piggybacking off of Ms. Ben James and Ms. Watson, it's called aging out of the foster care system.
Yes.
That's it's always been a big problem. Just to cross populate the Public Safety Committee, maybe 2 months back, we had a presenter from Homeland Security. In Brooklyn, we actually have a human trafficking unit. A lot of the people that are being human trafficked, male and female, most of the people come from the foster care system. And they're young. They've aged out of the foster care system, and they're basically living on a survival mode because that's where they came from the foster care system, and now they're on their own. So they're trying to they know they're here. The people in those of us on the Public Safety Committee had no clue. Well, you had somewhat of a clue, but you didn't know how prevalent it was in this district. But it is real, it is there, and they are working on that. I learned a lot as well. I'm not sure, Ms. Ben James, if you attend the Education Committee, but I do notice that a lot of us are cross-referencing a lot of the committees because they all overlap at some point or another. Maybe that's something that could be brought to the Health Committee, the Education Committee as well, because we've crossed. A lot of us here see each other several times a week. To just bring that to them, because they will have more insight in reference to the education of the children and what are their traumas and how we can avoid them from going from school to homeless. And a lot of times it's usually with foster care system, into the foster care systems, how they end up that way. That's all I have to say.
No, but it's called generational trauma. And one of the biggest thing now that they're looking into our community, they call generational trauma, and this has to do with slavery. And so we are dealing with generational trauma, community of color. And I think that's what we, as a health committee, one of the things we need to look into, because I remember doing a thing on education, and it is like, and my grandmother and my parents poured into me, but if I'm a mother and I have nothing to pour into my baby when I become pregnant, guess what that baby is going to become? So, and those are things we need to look into. Generational trauma, what happened to our, because in the 60s, Rosa Parks still had to stand up and give her seat. So people who went through that trauma in the 60s, their parents, their grandparents, we need to track those families to see what happened to them. When a child come home, a woman come home and tell her children, I have to stand up and give somebody else my seat. And she's pregnant. What become of that child when that child become an adult? Is that child 100% whole mentally, psychologically. So those are the things as a mental health committee we need to look into.
Yeah, and Miss Ben James, a lot of stress and trauma transfers to when
The
a woman's
fetus.
pregnant in utero before the
Yes,
child is
that's
even
what I'm.
born.
Yep.
Yeah, so absolutely. And I remember
Yep.
when I used to have adult clients, when I used to do therapy with adults, I had one client, he was from the deep rural South in Alabama, and he had to catch water for his family because I guess that's how it worked back then. They didn't have the sophisticated indoor plumbing that we do now. And where he caught water at was on a white side of town. And unfortunately, whenever they would see him, at that time he was age 8, 9, 10, they would release dogs on him to chase him. And this was a repeat that he went through. So he developed, because there is a form of schizophrenia that could be developed by chronic trauma, experiencing trauma over and over again. And he did develop that form of schizophrenia. And that was a lot of our work together in therapy. But when you talk about the generational historic lens of trauma, 100%. This was a grandfather who was impacted in that way.
I read a book recently with my classroom, and I get everybody should read it, called Roll of Thunder, Hear My Cry. And it spoke about what happened in the 60s. And guess what? I'm going to give you guys my age. I was already alive. So think about, read that book and about the schools and what happened. How it called Roll of Thunder, Hear My Cry. And I remember it's like, students can't believe that happened in the 60s, that Black people went through that. They had to wait until the other folks use the book and don't want it any longer. I see Miss Langley shaking her head.
Yes.
And that's a trauma. That is
Yes.
trauma.
Yes.
So that's the book we need to let our young people read. It's called Roll of Thunder, Hear My Cry.
Yes.
And she spoke about what she went through as a school child.
Mm-hmm. I was born in the 40s, so I know all about it. I was born in 46. So I was already a big person at that time.
Good.
Mm-hmm.
My people have definitely been through a lot.
Yes.
Yeah. And it's so hard because I do work with young people in the school as a social worker, and when I talk to our families that there's no way we can like how could we avoid taking care of our mental health, but so many of our families of color are just not on board with mental health care. And it's a real, for me, like a daily battle.
Yes.
A daily battle. Some parents don't even believe in depression, anxiety, and stress. I'm being told, what are they stressed out for? They have a better life than when I was young.
Miss Watson, please forgive them. Yes, trust me. I understand what you're going through, but you need to sit and talk to those parents, and you would see there's something that they're holding on to, an experience that they went through that they're holding to, and there's mistrust. And I know that because I speak to a lot of my students, and I learned that during COVID when it comes to the vaccine. How many people who look like us refuse to take the vaccine, and they tell you what their grandmother went through and what this person went through, and they didn't, because if you know in the 60s, they were giving the promised parents in the 60s when they have a child with special needs, they're going to give them contraceptive so they wouldn't get pregnant. But do you know what they did? They sterilized them. And this happened all the way into the 70s, early 80s in down south, that they were sterilizing people with special needs. So those are the things we need to talk about. That's why people are very hesitant.
I saw something today and it resonated in my mind since 6:30 this morning. And I try to move forward with this in my life. I just never seen it in words. Try not to take your generational traumas and put it on the next generation.
Yes.
That is so important. Everybody goes through trauma. Each generation goes, as we hear on this panel tonight, we're all of different ages, age groups on this panel, in this chat right now, and we've all been through different traumas as far as our generation. I've always lived with my offspring to not put my childhood traumas onto her. Just something is like, I remember vividly, I was telling my sister who's 32, having to walk through school, through the schoolyard, over crack vials, over syringes, because that was the drug epidemic in the late 70s, early 80s. She's never seen that. My daughter has never seen that because she's only 8. But these are things like I try not to put your generational traumas on the next generation. And I think that's probably be the only thing that will one of the things that will hopefully move us forward to help us move past the generational traumas, but at the same time give us a guide to that next generation of trauma, because we're all going to have traumas, but it's how we deal with them. Trauma, the generations of the 60s and the 70s didn't believe in therapy, but as Miss Watson just attests, that the younger generation, we're pushing therapy, making normalizing it. So maybe in their interaction, in their childhood, in their adolescent, they'll move forward with their children into where mental health and the talk of therapy will be normal.
Yes.
Anything else, ladies? Because it's 7:46, and we had a very eventful,
Yes, we did.
vivid conversation. Yes, Miss Ben James.
Yes.
Like I said, I've expressed to the board that I really love that a lot of the committees are co-mingling, as I call it, because a lot of things touch people, and you don't realize what touches one until we all talk to each other. Even personally, I can attend more meetings this way. When we were in person, you have to be. You couldn't. There was no way you couldn't go to all the meetings and be fully functional at all of the meetings. I actually like it this way. I can pop up a phone, computer, and always be present at the time and at the moment, and still cross connect, because I don't visualize us cross connecting when we go back into a building to have a meeting. To us, I probably wouldn't see Ms. Granville 4 times a month or 5 times a month. I wouldn't see Ms. Francis I wouldn't see Mr. Mensah all these times a month. But because we're able to do it on Zoom, and Ms. Tate Hall, I see all y'all. I see y'all more than I see my coworkers. Yeah. But
and Miss Jordan. Miss Jordan's on youth and education, I believe.
Yeah, I see. I can only see half of my screen, and my list is long. It's off the computer screen. All the students are going. This is just regular community members and board members. I see them. We all see each other several times a month, and I like this dialogue. I think it's very healthy. I know it's healthy for me. Does anybody else have anything else to say?
All we have to beg the Lord. They're saying that one of the things always my prayer, I said, Lord, it said the sin of the parents go for second, third, and fourth generation. And when my dad died, I said, Lord, let him take his sin with him. And I always say, Lord, don't let my children and my grandchildren. No, that's my prayer. Don't let my children and my grandchildren take my burden. And that is my prayer. Yeah, and I hear we need to do that, because if we don't do it, it's going to go on their shoulders. So we need to put that in our prayer. You know, who are Christian and who believe in prayers? Yes. I don't want to
prayer
say no
changes
one.
Things.
You don't have to.
Prayer is things, baby.
Write it down. Write it down.
You don't have to be only Christian. Every religion out there should be doing this.
Yeah. Yes, do it. Put it in your prayer. Lord, I remember visiting my father box, and I said, whatever you done on this earth, you take it with you to your grave. You're not leaving it for me to carry, being an only child. And I say that every night. Yes. Because Ms. Gibbs, we cannot ask not for our children to carry our burdens, and we don't pray to change it. That's a tidbit I'm sharing.
Yes.
Thank you, Lacey. I love this. You see how we couldn't do this. We couldn't have, I know it seems like me and Ms. Watson are on the younger end of the spectrum, and we have more of the seasoned people who who are giving this knowledge. I don't know about you, Miss Watson, but I'm just sucking it in.
Yeah, same here. I feel like every week I'm learning something. Every month I'm learning something, and I just want to also thank you, Ms. Gibbs. I feel like you really, as a new community board member, a lot of this could feel really foreign, and it's easy to get lost in all of the different language and vocabulary, and things move so fast in a general meeting. But you did a really wonderful job of like taking me under your wing to give me an opportunity to be a part of the work, and
Hope you
I
can
love
hear me
that.
clapping.
I love that.
And
Thank you so
and
much.
I'm simply thanking the community board members from which I came. I've actually started coming to the meetings at the end of Mr. Matthews' term. I remember Miss Granville sitting at the head of the table. So I've been around for some time. So I believe me, what I'm giving you, Miss Watson, I've gotten it from them, okay?
And I got it from the
And
previous generation. It's been a family thing.
And I'm gonna tell you guys how long I've been hanging around Board 8. Since in the 80s when they used to meet at Albany Daycare Center, in Albany. And
so this
at
is
the church at the corner of St. Mark's and Kingston, that's 7 Days Adventist, and used to meet there. No, none of you here know about that. That's how long I used to hang out with them. Not a member. And I remember raising my hand in the meetings and say, I have a question. And somebody go, oh, you cannot speak, you're not a member. I
Yes,
said, but I pay taxes and I'm a community resident,
yes.
with me. And yeah, so I understand. And as
like
we see,
again,
things
I
are
said, Miss
changing.
Watson, this is good at I love this pot. I love the pot and everything got to go in together. This is a very well seasoned community. And we have to just make sure it stays seasoned and just soak in everything.
Yeah. I feel like this was a big.
At least you have somebody. We're around the same age. I didn't have nobody when I started going. I was like, Miss Granville, clear name. She was very strict. Miss I swear, in like 6 years, I didn't see Miss Granville smile. I need everybody to sit down, quiet.
Mika, it's easy for me to
Yes.
smile now because I'm not the person that has to deal with the folks from the front of the room. See, when you're a woman and you're in charge, you have to be serious because otherwise people don't take you
They
seriously.
take you advantage, yes.
And she was Miss Granville was very serious about her business.
Yeah,
And I appreciate that.
Mm-hmm.
Yeah.
Okay,
Sorry,
ladies.
mental health committee, you don't see me often because I just jump off of another Zoom. So sometimes when you don't see me, I like my Zoom meetings so interlock and some of the meetings that I require to be there because I headed up. So sorry, don't feel that I only come in and drop things and I disappear. When I get off
James,
here, I'm going to
we
another
always know
Zoom
where to
meeting.
find you. We always know where
I'm
to
going to
find you.
another Zoom meeting, so sorry. I'm gonna try
No
to be
problem.
more present and more often. Thank you.
No problem.
I think Miss James has at least 1 or 2 books in her, so I'm looking to see that she's going to be publishing something soon because she's always doing research.
Miss Granville, it's funny that you said that. One of my former co-worker called me. She said, did you start that fashion business yet and start writing those books? Here you saying it again at the same time. She said it today and you said it again.
Okay.
That's the Lord talking to you. That's the Lord whispering to you.
Yes, and you know what? And it's about time I get off of myself. Everybody comes to me and I give them ideas, but I need somebody to encourage me because I'm doing a lot of encouraging of people to do this, do that, give them ideas. So Ms. Granville, please keep calling me and please staying on my neck. I can take that. I know you're not gonna do like the cops.
I will do that because nobody can speak better for you than you can speak for yourself.
Thank you.
And on that note, ladies, I would like to end this meeting. And anybody have any questions, concerns of minds are free and clear? Seeing none, saying none. Everybody have a good evening.
You
Good
too.
evening, ladies.
Bye.
Everybody next
Please drive safely.
Every driving with the traffic.
Have a good night. Thank you, Mr. Mensah.
Mm.